Use of ultrasound in the management of popliteal cyst. Conflicts of interest. I'm a stockholder of Sonics Health and co-editor of a textbook on MSK ultrasound and a lecturer for expert education. Ultrasound of the popliteal cyst can help you delineate the problem, treat it in clinic, or plan for eventual surgery. It also can help you avoid disaster. One case is a case of a cyst that grew off of an ACL reconstruction where the tip of the screw in the lateral femoral condyle had created an artificial cyst more toward the lateral side of the knee that included the popliteal artery in its wall. The other case is a case where the cyst is an artificial cyst is created by debris from a failing arthroplasty. The typical popliteal cyst, here it is in short axis or transverse view of the knee. The joint fluid leaks from the bottom where the knee is, the bottom of the image, into the cyst, the hypoechoic area at the top. The path it takes is shown here. You can barely see the path, and it doesn't allow the fluid to flow back and forth. Sometimes the cyst can be a little different. In this cyst, we can see fibrinous material in the wall of the cyst indicating a previous bleed into the cyst, and this is referred to as a ruptured cyst. Or this one is, I think, an artificial cyst created by debris from a unicompartmental total knee. You can see the debris dissecting on the deep surface of the gastrocnemius in the lower left-hand corner. Here is a long axis view of the stem of the cyst shown by the arrow. It is passing between the medial gastrocnemius, which is shown above, and the semimembranosus, which is seen only as sort of a shadow in negative anisotropy, more toward the right side of the image. Here is a specific view of what the semimembranosus tendon and insertion look like. Here we're going to move from the posterior medial view of the knee toward the middle, showing the two tendons. In mid-portion here, running from left to right, is the tendon of the semimembranosus, and then we will move from there laterally toward the middle of the knee, and we can see the tendon of the medial head of the gastroc. And then we see only cyst, which is superficial on the medial head of the gastrocnemius. This view is taken with the knee in extension. You can see the semimembranosus and its more superficial friend, the semitendinosus, and the back of the knee. Here, moving more to the middle of the knee or even lateral, and we can see the popliteal vessels. The vessels, it's important to note, tend to be somewhat lateral. They're not quite in the midline. They tend to hug the lateral femoral condyle, which gives us a margin of safety on the medial side. There is the popliteal artery, and just below it or deeper to it is the tibial nerve. Here we're going to move from we're showing actually the medial meniscus and its relationship to the cyst and the gastrocnemius with the knee in extension. Here we are placing the needle in the long axis of the cyst under ultrasound guidance. Here we are aspirating the fluid, and the ultrasound helps you keep the entrance of the needle away from fat or synovium that might plug it up temporarily before you were done fully aspirating. And here we're injecting a little bit of Kenalog and withdrawing the needle. At surgery, we would plan on creating a fenestration between the knee or next to the medial femoral condyle into the cyst. and this can be done very well arthroscopically. And we would create a passage that is at least 1.5 centimeters in diameter between the knee and the cyst. This then allows fluid to flow back into the knee where it's more readily absorbed. However, the surgery is successful pretty much in all cases, except when there's a condition in the knee producing abundant fluid. This can be degenerative, as in osteoarthritis, or it can be autoimmune, somebody who has a synovitis related to an autoimmune disorder where it produces too much fluid. And in that case, the failure of the operation is due to the knee is not absorbing the fluid. Thank you for your attention, and we hope you have enjoyed this video.